looking for redness, abrasions, or blistering.
As a nurse, you see people every day whose clinical status or treatment procedures affect their mobility. One potential major risk from immobility is the development of a pressure ulcer, a disruption of the skin that impairs the body's primary barrier against microorganisms. A pressure ulcer can be serious, debilitating, and even life-threatening. Your role in preventing and treating pressure ulcers is key. This presentation will outline the factors you must understand to assess the risk of pressure ulcer development. It will also demonstrate the skills you need to prevent and to treat them.
Okay, I'm just going to irrigate this wound.
As you watch, you will see how a patient's clinical status and current therapy affect the potential for developing skin problems. You will learn how to provide for a person's comfort, dignity, and privacy during your care. Finally, you will see how to integrate prevention and treatment measures into a patient's total plan of care, so that changes in skin condition or wound status are anticipated and appropriately managed.
I'm going to feel for a pulse.
To place these skills into context, you will meet two residents of a long-term care facility. Mr. Rader has advanced dementia and is unable to initiate and complete turns or position changes by himself. Mr. Rader is also underweight and is incontinent of urine and feces.
Hi, Mrs. Jensen.
Mrs. Jensen has diabetes with poor circulation in both legs, making ambulation painful and difficult. Mrs. Jensen is also overweight, and even though she is ambulatory, she needs encouragement to get out of bed.
How's that?
Using Mr. Rader and Mrs. Jensen as examples, the skills addressed in this program are assessing a person's risk for pressure ulcers, preventive measures, and treatment of pressure ulcers. Remember, when you perform each skill, you need to follow infection control guidelines, promote safety and comfort, protect the individual's rights to privacy, confidentiality, personal choice, and participation in decisions when appropriate. You also need to select proper equipment based on a person's needs, physician's orders, and agency policies. Many factors contribute to a patient's risk of developing a pressure ulcer. It is important to note that, while skin problems are not inevitable, a pressure ulcer can develop in spite of careful preventive care. An important first step is to understand how ulcers form and the factors that increase a person's risk of developing a pressure ulcer. Pressure ulcers are defined by the National Pressure Ulcer Guideline Panel as localized areas of tissue necrosis that develop when soft tissue is compressed between a bony prominence and an external surface for a prolonged period of time. Initial signs of skin breakdown can be very subtle, with slight reddening or discoloration of the skin. A system of staging is used to classify a pressure ulcer by the depth of tissue destroyed. Here you see an example of a stage 1 ulcer, with an isolated area of reddening in the surface appearance of the skin. As you will see in the progression of this ulcer from stage 1 to stage 4, there will be an area of full thickness skin loss and destruction of underlying tissue.
Vicki, I'm going to give you a report on Mr. Rader.
Assessing a person's risk of developing pressure ulcers requires a comprehensive review of his or her overall health and an assessment for the presence of specific risk factors. Your assessment data should be reviewed with the entire nursing team so their observations can be reported in a timely manner. Key elements in your risk assessment are: what is the individual's overall health status? What risk factors for pressure ulcers are present? What risk factors can be modified? And what level of understanding and participation can be expected from the patient and family in efforts to prevent pressure ulcers? A review of the patient's medical history helps to determine if active infection, nutritional deficiencies, or circulatory problems exist, creating risk for poor skin integrity. Laboratory values, such as total protein level, will reveal the patient's nutritional status, a potential risk factor for tissue breakdown. For example, Mrs. Jensen's diabetes is a health factor that increases her risk due to circulatory problems affecting her legs and usual level of physical activity. Her excess body weight also increases her risk. While adipose tissue in small amounts normally aids in cushioning bony prominences, excess body fat is poorly vascularized and susceptible to injury from pressure.
Get you moved up in bed a little bit.
Mr. Rader's mental status affects his understanding of and participation in preventive measures. His mobility is also limited, and his nutritional status is poor.
1, 2, 3.
In addition, since Mr. Rader is incontinent, there is a higher likelihood for his skin to be exposed not just to moisture, but also to the harmful effects of urine or feces.
Sharita has done an excellent job of making sure that we keep him dry.
The nurse can assess a patient's chance of developing a pressure ulcer through the use of an assessment tool such as the Braden Scale for predicting pressure sore risk. The scale consists of 6 factors, scored from 1 to 4, with a score of 1 representing the highest risk and 4 representing the lowest risk. These factors include sensory perception, moisture, activity, mobility, nutrition, and friction or shear. The Braden score can be used as a baseline for ongoing assessments over time. Here's an example of how it works. Mr. Rader's dementia translates into a reduced ability to sense and meaningfully respond to pressure-related discomfort. His score in the sensory perception category is 2. Mr. Rader's score in the moisture category would be 1. However, this is a modifiable risk factor, requiring careful planning to reduce the effects of his incontinence. Mr. Rader is bedfast and must rely on others for such activities as repositioning and exercise. His activity score is 1. As for mobility, he is unable to initiate changes in body position without assistance. His score is 1. Mr. Rader's nutritional status is poor. He is rarely able to eat a complete meal and only eats about half of any food offered. His intake of fluids and liquid nutritional supplements is reduced. Mr. Rader's nutrition score is 2. Friction of skin against another surface may result in a break in skin integrity. Shearing force is the pressure exerted against the skin when a person is moved or repositioned in bed by being pulled or allowed to slide down in bed. As the layers of muscle and bone slide in the direction of body movement, the underlying tissue capillaries are compressed and may be severed by the movement during change of position. Because Mr. Rader requires maximal assistance in moving and frequently slides down in bed, his friction and shear risk score is 1.
And what's his total Braden scale?
After total assessment using the Braden scale, Mr. Rader's total Braden score is 8, making him a high risk for a pressure ulcer. Your assessment should also include inspection and palpation of the condition of the skin in response to pressure. Use a body chart to mark any unusual findings. Look for normal or abnormal reactive hyperemia lasting less than 1 hour, blanching, induration or localized edema under the skin, pallor and mottling, tissue loss, scabs, blisters, or pimples. Your assessment also needs to include areas of potential pressure against the patient's skin caused from application of therapy equipment and devices. These areas include the following: the nares, when an oxygen cannula or nasogastric tube is in place; the tongue and lips, when an oral airway or endotracheal tube is in place; the skin, when an intravenous access device, drainage tube, Foley catheter, or orthopedic device, such as a brace, splint, or cast, is in place. Document your assessment, the Braden scale score, and other findings to plan appropriate interventions and to compare in ongoing assessments. Keep the body chart in the record to monitor specific problem areas. Carefully document any changes in skin condition by location, size, temperature, color, and texture. Monitor these changes daily as you implement steps to prevent further impairment in skin integrity. Preventing pressure ulcers is much easier than trying to heal them. Good nursing care, cleanliness, and skin care are essential. But other measures are also important, such as repositioning at appropriate intervals and using pressure and friction relief devices. Key elements of your planning to prevent pressure ulcers include the following. How often should a patient's skin be inspected? What measures are needed to promote optimal cleanliness? What are appropriate positions for this individual? What is an appropriate schedule of position changes? And what pressure relief devices are appropriate?
Sharita, I want to go ahead and review Mr. Rader's care plan with you.
Assistive personnel play an important role in preventing pressure ulcers. Communicate the following information when you delegate care. Review the patient's overall health status and specific risks for pressure ulcers. Identify any current skin problems. Explain the positioning schedule you have planned. Review the use of pressure and friction relieving devices and how to use them. Identify supplies for bathing and moisturizing the skin.
Mr. Rader, I'm going to continue to check your skin, and I'm going to show Sharita what I'm looking for.
An essential step in preventing pressure ulcers is to inspect a patient's skin every day.
Because this is an area where there's pressure for someone who's in bed.
Take special care with areas at high risk for breakdown, such as bony prominences and pressure points. Note any complaints the person may have, such as a tingling or burning sensation or pain. The color may vary among people of different skin tones and color. For example, redness and blanching are present in light-toned skin, and purple or bluish discoloration may be seen in people with more darkly pigmented skin.
Now, Sharita, when we're inspecting the feet,
also check skin temperature and texture. Isolated areas of coolness or warmth should be noted and monitored. Extra firmness or tightness also may be early signs of a pressure response.
And also you can check capillary refill on his toes.
Compare your findings daily with your baseline assessment and carefully document any changes. Good skin care is another step in preventing pressure ulcers, and bathing should be planned according to each patient's need. Choose soaps carefully to avoid dryness and irritation.
Okay, Mr. Rader, now I'm going to put lotion on your feet and ankles.
Apply a moisturizer to dry areas of Mr. Rader's skin, such as his hands, elbows, legs, ankles, and heels. When a massage is performed, be especially careful around bony prominences and avoid reddened areas. Massage of reddened areas can cause more tissue injury.
Mr. Rader, Sharita and I are going to reposition you now.
Positioning and position changes are a critical step in preventing pressure ulcers. Perform full position changes at least every 2 hours.
There we go.
It is important when turning to position patients so as to minimize the risk of pressure on the skin. One position that is recommended for a person at risk of pressure ulcers is the 30-degree lateral position.
1, 2, 3.
This position is like the side-lying position, except that it avoids putting pressure directly on the greater trochanter. After turning Mr. Rader onto his side, have him relax and lean his upper shoulder back against a pillow. This turns the hip laterally. Then place a pillow between Mr. Rader's legs. Be careful to avoid shearing and friction during lifting and moving. He probably will need help to shift the more dependent hip slightly outward. Provide a pillow under his head for comfort, but do not raise the head of Mr. Rader's bed more than 30 degrees, except as required for care, such as feeding.
Mr. Rader, that's a little better, and that'll take that pressure off your hips and your back.
When there is a high risk of pressure ulcers developing, a variety of pressure relief devices can be used to reduce pressure and friction. For specific sites, there are devices such as elbow protectors and heel protectors. For larger areas, there are bed cradles and air flotation mattresses. Mr. Rader's bed has an air flotation mattress beneath the bottom sheet. The mattress helps to distribute body weight more evenly. In addition, elbow protectors are placed on Mrs. Jensen. The soft fabric and plush filling are gentle to fragile skin and prevent friction between the bed and her elbow. A foam foot stabilizer is put on Mr. Rader. It provides effective protection from heel ulcers and foot drop. In addition, a disposable foam heel protector, sometimes referred to as a heel boot, may also be used short-term. When using protective devices, be careful to check the patient's circulation often. A pressure ulcer is an open wound and heals by secondary intention. For example, this is a stage 4 pressure ulcer, which has full thickness skin loss with extensive destruction and tissue necrosis. Specific treatments, including cleansing, applying topical agents, and dressing changes, are a nursing responsibility. Key elements in planning wound care include the following. What is the current wound status? What dressing is appropriate or ordered at this time? What treatments are ordered? What equipment and supplies are needed? And what infection control measures are required during the performance of wound care procedures?
Hi, Miss Goodwin.
Prior to a dressing change, the nurse assesses Mrs. Goodwin's level of comfort and need for pain medication. Just before beginning the procedure, gather your supplies. There are multiple types of sterile dressings, irrigations, and topical agents used in the care of a pressure ulcer. When providing this care, it is important to remind the person not to touch supplies or the wound.
A little bit here so that I can see your wound.
In addition, use principles of asepsis and standard precautions in wound care and proper disposal of used dressings and equipment.
Dressing off. Let me know if I hurt you, okay?
Carefully remove the dressings
Now I'm going to move this dressing off, okay? I'm going to hold your ankle.
and inspect the dressing and ulcer for drainage, foul odor, and tissue necrosis.
Okay?
Remove your gloves and dispose of your supplies according to agency policy. Use the appropriate cleansing agent to remove bacterial and surface contaminants. The ulcer is usually cleansed with normal saline to remove wound debris. Cytotoxic solutions would kill the fibroblasts needed to heal the pressure ulcer.
Really good.
Also, antiseptics can damage tissues unprotected by the dermis and may inactivate some medications.
Great.
Be sure the surface is dry because retained moisture promotes maceration of skin layers. Remove your gloves and replace them as needed to maintain asepsis throughout the procedure.
Is that tender at all?
Assess the pressure ulcer and surrounding skin to document its current condition. Note the color, moisture, and appearance of the skin around the ulcer and of the ulcer itself.
Do you have any numbness or any tingling?
Remember, a clean pressure ulcer should show evidence of some healing within 2 to 4 weeks. Observe the skin surrounding the ulcer for inflammation, edema, and tenderness. Monitor the patient for signs and symptoms of infection, including fever and elevated white blood cell count. Always compare observations with previous notations in the medical record.
I'm just going to measure the wound now, so just hold real still for me.
Measuring the wound is important to monitor the wound healing process. These measurements may include wound surface area and wound depth or volume. To calculate surface area, measure the maximum width by the maximum length as they lie perpendicular to each other.
Okay, you're at about a 5 by 7 now. That's much better than it was last week.
Then multiply length times width to obtain the surface area measure.
About 2 centimeters round all the way.
Also measure the extent of undermining skin by lateral tissue necrosis. Use a cotton-tipped applicator and gently probe under skin edges. Undermining represents the loss of underlying subcutaneous and muscle tissue to a greater extent than the skin. Undermining may indicate progressive tissue necrosis.
Right at 2 centimeters. That's definitely much improved.
Depending on the degree of undermining and tissue necrosis, wound irrigation may be
I'm
necessary.
wearing goggles because sometimes there's a little splash with irrigation.
While wearing sterile gloves, use an irrigating syringe to cleanse the wound.
Okay, Mrs. Goodwin, I'm just going to put a wet dressing on here followed by a dry dressing, okay? Just like we've been doing.
Then apply the appropriate dressing and secure it with tape.
The wet one. That feel a little cold?
No, that's okay.
There's the dry one. Now I'm going to wrap you with some gauze. Hold that in place. Okay, Mrs. Goodwin, everything's looking real good.
Document your observations, wound drainage, wound appearance, the type of topical agent used, dressing applied, and your patient's response. Preventing pressure ulcers is a critical element of care for any individual with reduced mobility. By systematically assessing a person's risk, planning preventive measures, and implementing nursing care and prescribed treatments, you make a significant contribution to this effort. Your care helps your patient avoid the discomfort and potentially serious complications of a pressure ulcer. It also promotes your patient's overall comfort and well-being.
That's much better.